If you're dealing with chronic UTIs or bladder infections, that must make you pretty much the worst person ever, right? No, that's not right at all. That's not even a little bit true. And I hear from people a lot that are dealing with recurrent UTIs and they just make it sound like they must be the worst person ever and what am I doing wrong and what's wrong with me, and just don't view it that way. It's not your fault. The medical world doesn't explain the situation very well, and for the most part they just want to throw antibiotics at it. So in this video you're going to get to understand the most common underlying issues that can create recurrent UTIs, and you're going to get to understand two simple steps that can help get rid of them. Let's jump in.
TC Hale is not a doctor and does not claim to be a doctor or licensed in any type of medical field. Don't be an idiot and use anything heard on the show as medical advice. This information should be used for educational purposes only, and you should contact your doctor for any medical advice. Now get off me.
Let us know in the comments section below what steps you've taken to try to improve your recurrent UTI issues, and let's see if that can help somebody else. But for the most part, the microbes that create these UTIs, or they can happen in the urinary tract or the bladder, but we just like to call them UTIs, and that's kind of what we'll be covering here. So know that we're talking about either area where a person can create an infection. But the microbes seem to be available in our body already for the most part, for most people. And E. coli seems to be the most common little guy that causes problems for UTIs for most people. And E. coli seems to be neutral in the body, but there are circumstances that can change the environment that can make these little bad guys problematic. One of the factors that can help these microbes thrive and replicate out of control is excessive sugar or carb consumption. This seems to help them really thrive, and so you might want to check out how you're doing there and see if you need to create a reduction. But the biggest factor that we really want to talk about in this video is we want to look at the pH of the urine. A urine that's leaning too far on the alkaline side seems to help a lot of these infections thrive and gives them an environment that helps them replicate better and kind of grow out of control and just take over the whole place. So if you can look at your urine pH and it's higher than 6.1, that can be an indication that the environment is set up for these UTIs to keep coming back. And if you can take steps to lower that urine pH, then the environment where they're living is not as hospitable to them. So you can take steps like, you can take a vitamin C in the form of ascorbic acid. That can lower urine pH, but it's important that it has to be in the form of ascorbic acid, which is a form you can find pretty much anywhere. Any health food store or pharmacy is going to sell vitamin C in the form of ascorbic acid. Just don't look at any vitamin C like it's going to do the same thing. It really needs to be ascorbic acid to lower your urine pH. Another step you could take is B6, also has the ability to lower urine pH. Now, we hear a lot about cranberry juice, and for a long time people felt like, oh, cranberry juice lowers the pH, and that's why it's so effective at getting rid of UTIs. But it seems that cranberry juice may also have an anti-adhesive effect. So a lot of these little microbes seem to have the ability to clamp onto the sides of the bladder wall or the urinary tract wall lining, and when they can clamp on, then they can really thrive there and replicate and kind of create a lot of trouble. So when they can't clamp on, then they just get peed out and they leave the body and it's not such a big deal. So it appears that cranberry juice may be able to work as sort of like an anti-adhesive and make it harder for those microbes to clamp onto the side of the wall. So that can be one benefit with cranberry juice. We're just not a big fan of using a lot of cranberry juice because even though it may have that benefit, it also has a lot of sugar in a liquid form. In that liquid form, the sugar can kind of get into the system a lot faster and create a lot more problems. So here you are trying to use something to get rid of a UTI that has an ingredient that can kind of magnify UTIs. So they do make cranberry pills, and that may be a better option, but it just doesn't seem to be the most effective option that we see. Now there are other options that a lot of people seem to have success with, like buku and juniper, and the one that we seem to see the most success with is D-mannose. D-mannose is a supplement that you can get in powder or capsule form, and we seem to see that the powder form is a little more effective because you can mix it with water and it can kind of get into the system a little bit faster. And basically it's kind of like a sugar in its chemical makeup, but it doesn't really react like a sugar, like cranberry juice would, or consuming sugars or carbs. It doesn't react that way in the body. And basically what it's really great at is coating that bladder lining wall, or the urinary tract lining wall, so that it's too slippery for these guys to clamp onto and hang onto. So when the lining is too slippery, they just get peed out, and now it's not a big problem. So D-mannose seems to be most effective with E. coli. So if you're dealing with some other type of infection, it may not work as well, but that's why we like to include the step of lowering the urine pH. Lowering urine pH seems to be a great step to help reduce the ability for a lot of these other microbes to be able to flourish. So between those two steps, we see a whole lot of success. So those are those two main steps that we like. Now there are other things you could do to help out, like reducing carb and sugar intake like we talked about. You could also increase water intake to help there be more water to wash out the bad guys. But you really need to look at your water intake, because not everybody qualifies to drink a whole lot more water. If you're a person that has low blood pressure, that can be an indication of a low level of minerals in the system. And if you start drinking a whole bunch more water, you could wash out a lot of those minerals and leave yourself very depleted. So that can create issues like depression and anxiety and other issues that we see with low blood pressure. So it can be important to know what your physiology looks like and know a little bit more about your body chemistry before you start jugging gallons of water at a time. We have a totally free digestion course that also walks people through the process of running simple self-tests at home that you can do with tools that you pick up at a pharmacy or a health food store, and they can give you a little more indications of where your body chemistry is and where imbalances are that you may be dealing with, so you don't magnify anything. So we like to see people take care of those, because if you're using tools to lower urine pH all the time for more than a week or so, it's possible to create imbalances in the wrong direction, and so it's really beneficial to understand where your body chemistry is. And that totally free course will walk you through how to do that, and we'll put the link to that down in the description below this video. Another tool that we teach people how to use in that course are 10-parameter urinalysis dipsticks, and you can get these on Amazon. We'll put a link to some in the description below as well, but you can just pee in a cup and dip this dipstick in there, and it can show you, do you have leukocytes and nitrite in your urine, and are those levels high? And understand that these are not diagnostic of a UTI at all. It doesn't do that. But if those two parameters are beyond the normal range, it's a strong indication that you may be dealing with a urinary tract infection or set up to have recurrent urinary tract infections, and you'll know that you might want to take some steps to improve that situation. So if this information has been helpful, be sure to click on the like and subscribe button, because that's what helps share this video with more people so that more people can find their answers as well. So we'll have the link to that totally free course in the description below. And beyond that, for now, for more health insights, watch this video on 5 mistakes that could be trashing your liver. I can't wait to hear about your results.